excited. This is like a real thing. I have a lot of special people in my life, but welcome to the Birth Queen podcast. Today I have my friend who I kind of like forced you to be my friend, I think, when I saw how fabulous you were and then learned you were a midwife, Uwera Rodriguez. So she's here with us, and I want to tell you like how we met. Our kids go to a fancy school. We don't need to say where, because your kids still go there.
School.
A private school. And they speak another language there. And we were at, what was it, like the first week?
I think it was the PTA information session or something like that. It was like
Yeah.
outside, right?
It was outside, and you like strolled in gleaming. Let me tell y'all, dripping in diamonds. I was like, who is this? Her skin, when you watch this video, you'll see how gorgeous she is. I was just like, oh my God, this Black woman is so gorgeous. And then she was just blinging. And I was like, I'm here for the labels and the bling. And then we got to know each other. And then she was like, yeah, I'm a midwife. And I was like, oh my God, like God like, totally wanted us to meet. And what's important, somebody's like, why does it matter that she had labels and bling? Why that mattered to me that she's a midwife blinging is because to me, a big foundational like pillar of Birth Queen was abundance. And yes, we have a Black maternal health crisis, but we do not come from lack. And you are Rwandan and Congolese. And it just was really important to me to have you in one of these first episodes to show what a Black queen looks like, because you are.
Oh,
And
you.
I know I'm like, get emotional. And you're a midwife and you bring forth life, but you're servicing a community that absolutely needs you. I don't know. Are all your patients Medicaid?
Mostly.
Mostly.
I would say at least 90% of them.
Yeah. So I just want to say thank you for being here and thank you for doing what you do. You've given birth to a lot. Not only you're a midwife, you're a mother of 3. And you made me just like feel so at home right after I moved to like the new community. So I thank you for that. And thank you for like being here. Oh, such a Pisces. Oh my God. So I would love, way hard for you to just like, I want people to know like your story, like where are you from, and then what made you decide to become a midwife?
Okay. So I'm originally from Rwanda and Congo. And so I came here when I was about 10 years old. There was a war in the Congo. So my parents decided to bring us here.
Mm-hmm.
And so we moved to Maryland. And then we still went back on vacation to Africa. We're still very grounded there. I still have a lot of family there. Especially during the genocide, which was like a really hard time, especially in Rwanda. So,
Remind me the years that was. I mean, we know
that
as
was in
Americans, like
94.
the movie, but
Yeah,
okay.
in 94. So, but yeah, so we settled in Maryland. I went to Penn State. I knew my dad always wanted me to be in the medical field. He always, as young as I could remember, was always like, "You're going to be a pediatrician. You're going to be a pediatrician." But I was like, okay, yeah, maybe. So, 1 year after college, I interned in a pediatric office, and I was like, "This is not really what I want to do." Because I was like, you spend a lot of time just kind of talking to parents and not necessarily the kids. And I love kids, but I just didn't see myself doing that. So I was talking to my dad about it, and I was like, let me go back to Africa and kind of just do an internship at a hospital. So I went to Rwanda. And I said to him, send me to like the poorest hospital in Rwanda. So he did. And I interned there and I started like in the pediatric department. I was like, this is not really want to do. And then I ended up um, on the labor floor and it was all midwives. And this is actually when I first find out what midwives were. I really had no idea because I think in the US it's not very common compared to other countries.
Right.
And so I was on the labor floor with the midwives and they were doing all these births and it was wonderful. And that's where I had my first birth, like there. And it was just beautiful because it's like you don't have all these resources and these people are actually like happy that you're there to help them. It's people who haven't had any prenatal cares, live in villages that are brought in with like pickup trucks and they're in labor. So I really got to see a lot of things that where I sometimes am at work now and I'm just like, wow, and it still draws me. Like, I still want to go back and help because I think like that's where a lot of the work needs to be done. But I also like people like are very appreciative of you. You know, it's
Hmm.
a different, it's a different kind of place. But I think it's also you learned to work with nothing,
Yeah.
and being humble about it. And I think, so I really love that. And so then I came back and I was like, Dad, I know what I want to do. I want to be a midwife. And he was
Hmm.
like, what is that?
He didn't know what it
He didn't know what it was either. And so he had a friend who was a doctor and he spoke to him. He was like, what is a midwife? He was like, that's great. It's wonderful. They're kind of like OBGYNs. They do deliveries, all of that. So I went back to school and I became a midwife. And again, I wanted to really work with underserved population. So I've been working in the Bronx ever since I graduated. So I did it. One of my last clinical was actually at the hospital that I currently work at.
was.
So
Okay.
that's how I started working as a midwife, and it changed my life and perspective as just, we're in a world I think where we need to learn to take care of each other as women,
Yeah.
no matter where you're from in your background, so yeah,
That everybody deserves
that deserve
care.
care. Yes.
What would you say for those that are listening are the key differences between an OB and a midwife?
So the differences are this. So we both go to school. We both
You mean
have a degree.
you didn't run out of the jungle
No, I
to
did not
like
run out of the jungle. I didn't practice this at home. I didn't learn it from somebody
it's
else.
not voodoo and
It's not voodoo.
witchcraft, right?
Exactly. We didn't learn. And a lot of, I think midwives have the stereotype of being hippies. We
Right.
don't have education, a background, all of that. You do need to have a master's in midwifery. So you do need to go to school. Um, and so the difference is I take care of a woman. Midwives actually means with women.
Mm.
So we take care of women from before you have children. So we can do your pap smears, your annual visits. We could, send you to get your mammograms, all of that. And then when you're pregnant, and then after the pregnancy. So the only thing that I cannot do is anything that has to do with surgery. So
Hmm.
if a woman has fibroids, had endometriosis, any type of surgery, I cannot do. That's the doctor that will do it. That's an OBGYN that will do it.
Right.
I do assist at our hospital. We do first assist, meaning that if a woman needs to have a C-section, I will go into the C-section, which I think is actually great because I'm
Hmm.
continuing that care, especially if I
Right.
was taking care
She's
of her.
not passed off.
She's not passed off to just a doctor. I will be there with her. I will talk to her. I will be there to help the doctor to do her C-section.
Hmm.
Um, so that is the difference. But,
Yeah.
a lot of people still call us doctor because it's confusing. But
Yeah. But I think what's really awesome, there's the history of the granny midwife,
yeah,
which were the black midwives in America, many of whom were slaves. But what I love about you being here is you can bring the perspective like coming from Africa and
right,
not from that lack standpoint
right.
of how that was the tradition that midwife with woman, we were with women
Yeah.
birthing a baby and just like holding space for a woman. So can you kind of like talk to what you saw like when you were in Rwanda, um, just the role of the midwife and just how,
Yeah.
because we were cut. I think once we got to America, we still continued to catch babies as black women. And then when obstetrics was born, it was a hard cut, right?
Yeah.
We were cut out of it. And now we're like re-entering. But unfortunately, there's very few black midwives, even though it was our thing.
Right. I mean, what what I experienced in Rwanda, what I thought was really beautiful and really nice is even the respect that the doctors gave to the midwives.
Mm,
They were literally, when I tell you, they were sitting on a bench. The doctors were sitting on the bench, and it was the midwives that made the call if
hmm.
they needed a C-section. It was literally the midwife that came to the doctor and being like, okay, this one needs a C-section, and then we will all go in the back and have that C-section done. But it's really that respect, and it was a good work environment, like they really kind of work together really well.
Yeah.
And there was a respect. And I think that in Africa, a lot of the hospitals, the men are not allowed in. So all the husbands were actually outside waiting. And it's
Mhm.
really the women taking care of each other. Like
Mhm.
it's really women together, laboring together and delivering together. It's so it's really about women kind of like supporting each other in that moment.
Which
And I
is why your
think
dad didn't know what a midwife was.
right. But it was like, yeah, so I think that we are continuing to try to do this in the US, but I think it's more common in Europe, in like Europe. There
Yep.
it's continuously midwives have continued to be there. I think in the US it has become a lot like medicalized, and so it's
Yeah.
like everything is about insurances and money and all of that. So
Mhm.
it's very, very hard that even me as technically I am an independent provider,
Mhm.
but because I am based in the hospital, so I am admitting the patient, I'm taking care of the patient, but the billing is through the doctor that's
Right.
on the floor. So
Oh.
we're not even recognized as being our own individual practitioners, even like at like a hospital. So that kind of has to change. And I think the change is happening because now insurances, you can get the insurance to reimburse if you're doing some of the home birth and all that. So they are realizing that midwives are valuable.
Right.
But again, it's got to be like a culture shift. Like everything's got to change here,
Mhm.
and it's going to take some time, but we got to keep like trying to
Yeah.
push it and make it happen.
I have like clearly like the big question of how we solve the Black maternal health crisis, but I know one of those solutions is Black care providers,
Yes.
more specifically midwives, doulas, and lactation. But my like solution nonprofit founder brain is like, how do we generate interest in the field of midwifery to Black women?
I think it's just even, um, I think we need to talk about it more. I just
Mhm.
don't think that people understand what a midwife is.
Yeah.
I think the more we talk about it, the more people are going to be aware of it and more people are going to demand to have a midwife. Even in New York, there are not that many hospitals that have midwives on
Right.
staff. It's very much um doctor driven, and I get that, but I also think that who's better to know about labor than women, right? Who who is better at knowing what it is to carry a child and all of that. Now, don't get me wrong, we do have male midwives, but it's a very, very small percentage. We
Mhm.
actually have a male midwife at our hospital. And I do encourage that. I think it's wonderful for men to also want to be there and support women. But I do think just
It's just different.
understanding it is different, but I think also understanding what a midwife does.
Yeah.
I am very much always confused. A lot of people either think that I'm a doula or that I'm a doctor. I'm called doctor all the time.
Uh-huh.
And I don't think that they understand.
Right.
I have patients coming in and they were like, well, I have a fibroid. I want to take it out. And I'm just like, well, I'm going to refer you to an OBGYN. And they're like, oh, you're not the doctor. I'm like, no, I'm the midwife. That's not my specialty. Doctors are surgeon. That's their
Right.
specialty.
Right.
They are there to do surgeries, and midwives are there to be with women the way that that it has been in the past
Right.
and should
Well, I mean,
continue
for
to be for
centuries.
centuries. Yeah.
And so I think what's also important for people to understand, like, just the chemistry behind, like, the need for a woman to feel safe. Like, I give
Right.
the analogy that a dog would never give birth in the middle of Fifth Avenue, right?
Yeah.
They know that that female dog knows it's not safe,
Right.
so she seeks out a quiet, safe space to deliver her babies. So the cervix literally doesn't open unless a woman is producing
Right.
oxytocin. And so what we're not seeing is that we're throwing women into this medical institution where most people go when they're sick and dying
Yeah.
and expect them to feel safe with random people coming in and out, checking clipboards and machines and never acknowledging their
Yeah.
humanity. And so we can't expect the body to feel safe in that environment. A dog
Right.
wouldn't, so why should we?
Right.
Like, and then you're like, yeah, I mean, I'm your OB, but I might not be there because I might
Right.
be golfing or it might not be my
Yeah.
shift. And you're like, so I'm supposed to just now feel comfortable with whoever just strolls in here and gives me a pelvic exam,
Right.
which is a good segue into something we get to discuss as like women and mothers and birth workers who are into this, but the importance of being sensitive to the individual woman
Of
that you're
course.
caring for and her story. And I always just love how you highlight you need to center that woman, and that's huge. That's a solution too. I
Yeah.
think for maternal care in this country is recentering a woman, because there's no baby without the mama.
Right.
Like that's just not a thing.
Right.
But please talk to me about how you approach, what you kind of go through in your mind of awareness of when you enter a room and before giving a pelvic
Yeah.
exam to someone.
I honestly I always remember that this is actually um a person, you
Right.
know. It's not a dummy. This is not a workshop or anything. Like, this is a human being there, and that human being has gone through certain things in their lives.
Right.
I encounter women who have been raped, women who have been molested, women who come from Africa and had a circumcision. Like, you have to be aware of what that person may have gone through in their lives. So I really explain to them everything that I will do. And I always say to them, because a lot of women have encountered maybe like somebody being rough during like a speculum exam or a vaginal exam. So
Mm-hmm.
they're always like, oh my God, this is going to hurt. I don't want to do this. And I'm just like, you know what? We will go
Really slow.
really slow, and you let me know when it's okay,
Mm.
and I try to have them breathe through it to kind of like relax their body. And I always tell them, the more you relax the body, the more, because if you're really tight and I'm trying
Oh
to do a
yeah,
vaginal
right.
exam, it's going to hurt even more. And I will give them every time in the world that they need, because
Right.
it's also, you're building trust with that person during that
Absolutely.
time, right?
Mm-hmm.
Because they're like, you know what, she was really nice and she took her time. So the next time when I'm going to come, she's going to be like,
You're not tense.
they're not tense, and their walls are down, right? They're not guarded, because they're like, this person's not going to hurt me, and this
Mm-hmm.
person is here working with me, and it's going to take all the time that that I need.
Mm-hmm.
So you really do not know what women have gone through in their past. So it's very, very important to just be gentle. I mean, imagine like imagine you being on that table,
Yeah.
and what you would want somebody to do. So I
Yeah.
think it's very important. And not everybody wants to disclose everything. I can go through and see a patient for the first time, and I'll ask her certain questions about her life, her background, all
Mm-hmm.
of that. And she may not feel comfortable divulging to me that she was raped when she was 15 years old, or that she was touch inappropriately at a certain age or whatever. But then during labor, sometimes those things come
Come
out,
out. Mm-hmm.
and sometimes they don't want to tell you because their partners don't know that. And so
That's huge.
they
Yeah.
are keeping it inside, and you don't want to look at somebody and be like, what is going on? Why are you acting this way?
Right.
So I sometimes, even when I do see a patient acting that way, I really try to ease things and just be like, you know what, I'll give you time. I can come back in 5 minutes. I will go slowly. I will guide you. I always, always, always tell them. I really think it's huge. You have to work with the person, and being open and understanding, and really have that open communication with them and let them know what's going to happen.
Yeah. I mean, I had as a doula, one of my early births, this lovely couple, we were stuck in triage because I didn't have a room. And every person that came in asked her, they went through that same checklist. And one of the questions was, have you ever aborted?
Yeah.
And she's literally there, like laboring, like intense labor. We're about to she's like almost fully dilated
Yeah.
with her husband, and the termination wasn't with him. And she had to continue to answer that question, like probably like 4 times.
Times.
And
Yeah.
I was just like, I was new as a doula, but I was like, something about this
Yeah.
is just what? Like, why does that matter? Like, she's
Yeah.
about to give birth right now. Like,
Right.
we're having a baby right now. So I don't know why all of that and how triggering that could be for the partner, for her,
Right.
for every, like, it's just, it was really off-putting. I mean, I've heard insane things that occur, including often a lot of Black women are asked if they're married, which is literally so inconsequential. And like, what woman in her, you know, third trimester is like
Right.
wearing their wedding ring swollen, giving birth? Like,
Right.
you're not wearing jewelry, except
Yeah.
for you, maybe. I like the jewels usually are coming off by like week 40 or week 30 even. So yeah, but I'm thank you for sharing that because I think it's really important. But because you're working with the Medicaid population, I want to start here. Like, birth is beautiful and it's safe,
Yeah.
right? If women are supported properly. But we can't deny that there is a crisis happening. And because you are working with, in the Bronx, typically with a Medicaid population, can you break down that it's not the woman that's broken? It's like our system and the solutions we can implement to continue to properly care for and have positive birth outcomes, which I know
Right.
you have both. Like, I'm privy to both sides, but I think it's important for us to know that there is a solution. And I absolutely believe that midwives and doulas and lactation counselors are a part of that. So
Right.
I would just love for you to, how is it being a midwife in an institution, right?
Yeah.
Serving that population, because it's possible.
Yes, it is. And I think first we have to have a lot more midwives and doulas and lactation consultant um that are Black, Hispanic. I work in a practice. We're about 16 midwives. We are 4 midwives that are Black and 1 Hispanic. And
There's
so
16 and there's only 4
16,
Black.
there's only
Wow.
4 Black women and 1 Hispanic. And the majority of our
Is a
population
right.
is either Black or Hispanic. So I think it's hard sometimes when you don't have somebody that looks like you, understands you, can connect. Because I have a lot of like African women that come in, they're like, oh, you're from Africa. And it's like a direct connection, right? And so
Mm-hmm.
then when we talk about nutrition and food, and I'm like, okay, you can't have too much of that foo-foo. Like
Yeah.
she knows that I understand
She
what
not
she's
like, oh, this girl
eating.
not gonna know what fufu is.
Right.
Right.
So, I mean, I think that connection is great. And even
Right.
having a provider that speaks your language, right?
Absolutely.
It's huge because as much as like you can have a translator, it's still not the same thing as having somebody that speaks that language, the same
Right.
language. It's already like a connection. And so I think having more of that would
Mm-hmm.
really help. But I think also, we need to break down that whole aspect of, Black people don't feel pain, that we have a higher pain tolerance, that we're stronger or
Our
with this.
skin
So,
is
or skin, yeah, or
thicker. Like,
thicker. I think all of that has to kind of stop for people to really understand. I mean, even when you look at all of the lab values, like all the lab values are based on white women, on white people, it's not Black. Like naturally, African Americans were anemic. Well, technically not anemic, our levels are lower than what a Caucasian person would be. But if you're basing on that, yes, we're constantly anemic,
right.
right?
I dealt with that with
Right.
my
So now
baby.
in our pregnancy, so you have to have somebody that understands that, right? That's
Right.
just kind of like, well, you're not really anemic. We just run on a lower level than what a Caucasian would. But just having all those understanding of things. But generally, we are anemic. So, but we have to look at how to increase that, and how to be able to relate that to someone, especially like in that population that I work with, it's a lot of education. We have a
Yeah.
lot of diabetic women, and they'll come to the prenatal visit with McDonald's and orange juice. But the reality of things, that is what is around. Do we have healthy options for
Right.
them?
So
Do we
you
have all
can't
those
judge
things?
them
So we
for the
can't
fact
judge
that they
them
live in a food
exactly.
desert, which was all by design. Correct.
Exactly. So
Right.
you cannot go to a really nice neighborhood like Westchester. You will not find a Popeyes. You won't find an Applebee's. You won't find any of that. But then you go to underserved, and that's all there is.
Yeah.
So even though, you do have WIC and stuff, but is there healthy options? Now they have been changed. There are a lot of farmers markets now that you could go and use your WIC and all of that. But it's even like teaching them, right, how to
Right.
cook healthy and how to do all that because it's from generation of, and it's the culture, right? Hispanics like a lot of their rice and beans and all of that. So even when I'm speaking to like all of my patients, I'm like, okay, a cup of rice, not going up like this, like a little cup. And they all laugh when I say that because I'm like, they know that I understand that even in certain culture, like your rice is your staple. Like you
Well,
have
yeah.
to, like, this is what you do. Like you have a lot of rice, a little bit of vegetable, and a little bit of meat. But the main is the
To
rice,
fill your belly.
to
Yeah.
fill your belly. Or to say, I get, well, the baby wanted McDonald's. The baby doesn't know. No. Like the
Yeah.
baby doesn't know what McDonald's is,
Right.
but I think it's just education, really a lot of education about it. I
Right.
think that that would, and on both parties, right? On the provider's
Right.
side and on the patient's side. Um, because I have even a lot of students that come through, I'll watch them speak to the patient and they're like, oh, well, you could go, do yoga and you could go get a massage and you could go do this. And I'm just like, they don't have that.
Right.
Unfortunately, that's expensive. And this is a different population. And it's very, like, we have to be able to adapt to things, but I think even increasing the resources that they can have, it would be
Right.
great if they could go get a massage. It would be great
Absolutely.
if they could go to a chiropractor and have all these services available. And I think that that's what we have to continue to advocate for,
Mm-hmm.
that it's still it's still provided for them, the
Right.
same thing that anybody can have with a private insurance.
Yeah. And the food thing to me, it really triggers the history of slavery. Like we had to figure out how to survive.
Yeah.
And so it wasn't that we didn't want what we were cooking for our master. It's we had the scraps
Yeah.
and were able to survive. So when we talk about abundance, like we're a very resourceful people who were able to figure out
Right.
how to be resilient with next to
Yeah.
nothing. However, we don't come from that. That's not
Yeah.
what we come from.
Right.
Um, yeah, and I think just not assuming, right? I think I almost addressed this with Lindsay, but when we were talking, but this idea that people think they get it. You know what I
Yeah.
mean? When someone's like, I understand. Like, we're both Black women of, fine African descent, but I'm not Rwandan. I'm
Yeah.
not Congolese. I wasn't born there. So even I am just going to have an openness to understand what your experience was because it is unique to
Right.
mine. And I think that's just all we have to do, instead of judge. Like I
Yeah.
just judgment is ridiculous. And the fact that also that we're able to check the box with survival is not enough,
Yeah.
because there's more to birth and being a human than just like having you and your baby survive.
Yeah.
Like, that part. Okay, so that's like your work stuff, which I love, and we can get back to it. But Weha also is a mommy. So how many
Yes.
kiddos do you have?
I have three boys.
Mm-hmm.
Um, I have oh my God, 9-year-old, a 6-year-old, and a 5-year-old.
Did you always
So
want to be a mom?
I did. I always wanted to be a mom. That was never like a question for me. I always wanted to be a mom. So yeah.
And how were your pregnancies?
I loved being pregnant. I really loved being pregnant. I had very easy pregnancies. Didn't have too many complications with them.
Mm-hmm.
But I did um, fight for what I wanted. And I think that I am happy that I was a midwife and understood a
Yeah.
lot about the medical um, healthcare system and medical aspect of it. So the thing about me is I had a fibroid when I was really young at the age of 23. I had it removed
Okay.
and I was told that I needed to have a C-section. And so contrary to what everybody told me,
Mm-hmm.
I believed that my body could do it, could just have a natural birth. I felt strong. I felt like my body was able to carry these children and be able to get a vaginal birth. But every doctor that I spoke to was like, nope, you had a myomectomy. We're done. You needed to have a C-section.
Right.
And I went to a group of midwives who said, you know what? I think you can do it, but we do work with this OBGYN who's super pro midwife, super supportive, and we
Right.
just want to run it by him because he's our backup, right? If we need a C-section, he's the one that we called. I said, great. So I went to his office and he said to me, he was like, he looked at all the operative report of how the procedure was done. And he said, I truly believe that you can do it. I am going to treat this just like as if you had had a C-section. And so this would be considered a VBAC. And I had 3 beautiful vaginal birth, with no complication. My uterus did not tear or any of that
Right.
rupture. However, I am not saying that every woman should do this, but I think that I think we need to trust women's bodies a lot more
Then we do. Yeah.
than we do. You know,
Yeah.
I think that's something that we need to do. We need to listen to women when they tell you, I think I can do this and I feel like my body can do this.
Mm-hmm.
And I think that it's worth giving it a chance, right? So now I did not have birth, I did not deliver at home. I was in a hospital setting because I think that was appropriate just because of that background. Um, and so I think that if you're in the proper setting with the proper providers that are watching over you and seeing what's going on and that are supportive of you, I think it's wonderful.
Right.
I think that what baffles me all the time, like we are the only species who don't do things in packs. Like we want to do things like it's always everything alone. Like even
Mm.
when you look at animals, when they give birth, there's animals around surrounding them, right? They always raise the cubs and all of that together.
Like
So
even
it's just
elephants, like it's
elephants,
serious.
right? It's
Like,
like everybody is
yeah.
together. It's surrounding that person and supporting that
Mm-hmm.
person. And I think that humans, we tend to not do that. And I think this is why we have a lot of postpartum depression.
Yep.
We have all that because there's no support system. I think
Yeah.
if there was a true support system where we came in and care for that, we would have a lot less bad like outcomes if
Yeah.
it, per se. So
Well, culturally, that's a big difference. So, like Wahab being, African and I being African American, I remember even just when we were all together last summer. So Wahab has a pool, and I have 2
yeah.
boys, and she has 3 boys. She's hostess with the mostest. We have that in common, but she might have me a little beat, but that was fine. Um, and so you have like all these kids running around and
Yeah.
adults adulting, and everybody's having a good time. And I remember Fuhara got up and because Samuel wanted to change,
Yeah.
it was time for him to get out of his
Yeah.
swim clothes. So she said, "Baby, where's your bag of clothes?"
Yeah.
And she just went, and I think we had met maybe once, maybe
Right.
twice, and she found his bag and got him changed.
Yeah.
And she was like, "Girl, sit down so you can have your drink," because
Right.
I've been chasing Baldwin trying to make sure he didn't drown. And she's like, "Just sit down." And it was so simple, but it was a group of women
Right.
being together, raising babies. Her kids are grown and she wasn't
Yeah.
at the same stage, but she recognized the stage I was in and that I just needed to sit down and have my
Right, and
drink.
have a break.
Like,
Yeah.
right. And she's like, "I got this. Like, just
Yeah.
enjoy your food and
Yeah.
your drink." And it was so simple yet so beautiful that she felt comfortable enough to help me mother
Right.
and mother me,
Right.
and that I could be sitting right there and just sitting and enjoying while she helped me
Right.
parent my son, or help whatever, get his
Yeah.
clothes changed.
Yeah.
And it seems simple, but I remember even speaking to that in that moment. And I do believe it was a conscious choice, right? Like when slavery
Yeah.
happened, that breakdown of the family and of
Yeah.
community, of course, I think we recreated it on plantations and such,
Right.
but that's what we come from. And it just felt
Right.
so warm and so right.
Yeah.
And I encourage women, not just Black women, but all women, especially as mothers, like this is no joke.
Yeah.
Like it's no joke to be a parent. Like
Right.
it's a lot. And it's so much more enjoyable when you
When
can
you're
do it
doing-
together.
exactly.
When they have a community of friends that
Right.
they get to hang out with, and when we get to sit down while they're
Right.
happy and we could be happy, sharing the good, bad, or the indifferent, but just
Right.
also resting,
Right.
So I believe that's important. And those are those things because I also have this thing with like the hiding.
Mm-hmm.
I hate that we hide we hide infertility. We hide a pregnancy loss.
Right.
We hide our first trimester. I'm like,
Yeah.
that's when you need people the
The
most.
most. Exactly. Yeah.
I remember when I had my miscarriage, I like just like had a day, and then I like threw my stretchy pants back on and like taught fitness, like,
Yeah.
hi guys. And I'm like, now I'm going, I don't really think that's probably
Right.
what I should have done, but I didn't tell anybody. And then every time I washed my hair was falling out and I had to relive it,
Right.
because my body was going through the fourth
Yeah.
trimester, you know? But these are things that have always just, I think as a person, I never, I'm not a private person. I mean, you don't know people
Yeah.
don't know all my business, but I think there is a way to share that's in a way to just say, like, I've been through this and this is what worked with me.
Right.
And then that other person feels safe to share. And then we're in this together because I don't
Together.
believe God designed this life to be lived alone.
Right.
I mean, even
Yeah.
just with tribes in Africa, like I
Yeah.
remember being so impacted when I visited the Zulu tribe. I was like, I didn't know I was into polygamy, but maybe now that I've had the experience at 38 dealing with men, I'm like, I don't mind sharing. I don't have to deal with you every day. This is great.
But I think this is how we're really, I think, meant to live in a pack almost. Like,
Yeah,
right?
yeah.
Everybody should have their pack, and whether it's friends, whether it's cousins and families. I was just having a conversation out there where, like, I was explaining that I have patients who are just like, I'm like, okay, so where are you gonna go? So now you have the baby. Like, do you have an apartment? And they're like, no, I'm living at my mom's house. But I was like, okay, so who's gonna help you after you give birth? And they were like, I'm gonna go to a shelter. And I was just like, what? And the first time I heard that, I was like, what do you mean you're going to go to the shelter? And she's like, no, I'm going to go to shelter because I need to get an apartment on my own. And just because of how the system is set up here,
Mm.
here she doesn't work. She's on welfare, Medicaid, WIC, all of that. For her to be able to have an apartment, she has to go to a shelter for a certain amount of months. Here we are with a brand new baby. And I said, I don't even think we have shelters in Africa. I have not seen a shelter in Africa. There will be a family member who will take you in.
Wait. You have to run this back. So
So,
the only way if
so the
I
only
am
way so from my understanding, don't quote me 100% on this, but the majority of my patients do go. And I asked about it, they said we have to go in order for us to get housing, okay, public housing. You have to go through the shelter system first. And once you're in a shelter and you register in a shelter, then the process of you having your own apartment or housing starts.
I don't even know what to do with that.
So it is so, when you really look at the system, it's a lot more, um, it's just, we really need to find a better way
To
to
say the least.
really help a lot of women, because I sometimes don't understand how, because in Africa it's just very different. We will never let you go to a shelter. Now, do we have issues in Africa where, yes, we do have women who will give birth and camp outside of the hospital because they can't afford to pay their bills. But there are NGOs that do come and pay the bills of those of these women. In hospitals in Africa, we don't have like a food service. Your family has to bring you food. So the families will bring them food every single day, until they can leave. That is more of a financial aspect of it. Here, I feel in the US, there is money. It's just the way the system
It's set up.
is set up. That it's almost like, um, example, like I had a nanny who 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 came in, was a single mom. She lived in public housing, and she said to me, I had to write her letters saying that she made less, because if she did tell them that she made more, her rent would go up. And so she's like, but I can't afford
Right.
to pay that rent. I'm already on welfare and all that. So it's almost like
It's built to keep you down.
it's
Oh,
built to keep you
absolutely.
down, And
Absolutely.
so I think that also has to change. Like, you can't, I would rather have her rent go last so she could continue to work and save money to now get out of the system, right?
But then they tell the story that everybody's just living off the system,
Right.
but it's built to keep you in it because
It's
they,
built to keep you in it.
yeah. I
So
mean,
yeah,
that's like,
yeah.
ugh. Um, what was, and this can be just however you interpret it, your biggest push moment? That could be childbirth or otherwise.
Um, I think probably the birth with my first child. Again, when you talk about, I did have an OB, he was on vacation. So I had somebody else in his practice come in, and when he saw that I had had a myomectomy, he was like, "Okay, we're gonna have a C-section." And I was like, "Nope, we're not doing that. That's not what I agreed with my doctor. That's not what
Mm-hmm.
we're gonna do." He said that I could try to have a vaginal birth and all that. And I think this is where I'm saying we really need to continue educating people and people knowing what is going on with their body and where they're at. I always come to my patient and let them know what we're gonna do. Okay, this is the plan. This is what I think you should do. Let's discuss it. Tell me if you're okay with this. Why I want to do this, what's going to happen, and all the other steps.
Right.
Because I think they need to feel empowered too about their birth plan, right? Like, this is what I'm doing. This is what's going to happen. I'm this amount of centimeters. I have to go to this. Really explain, because not everybody, especially with your first child, you don't really know much. You just kind of like, okay, what am I supposed to
Even people
do?
who like know stuff, like
Right. No
it's
stuff.
not
Like,
common.
I used to talk about contractions, but when you really feel a contraction for the first time, you're like, holy shit, like, what is this? Like, this is like, and
Your
then you tell
body is like
somebody, like,
opening.
oh, it's going to get worse, because you explain to them, you're like, it's like little cramps, but it's strong cramps. It's like stronger. But when you really experience it, you're like screaming. And some people have different pain tolerance. I've had women on the phone chit-chatting and they're like 9 centimeters and laughing, and I've had women screaming their lungs off at 1 centimeter. So it's like everybody's
Yeah.
very different. So
Right.
I think even like explaining that to somebody, I became such a different midwife after giving birth,
Mm-hmm.
because now you understand what it
Yeah. You're
is.
not like, breathe, honey.
Right, you're not like, breathe, relax, just oh
Yeah.
no,
Imagine a
it's
flower
like,
opening.
I understand when you're moving around and you're screaming and you're yelling at your partner, you did this shit, like,
I know.
so you understand all that.
You did this to me.
You did
I
this to me.
had both of the boys were OP, and I
Yeah.
remember when they're like sit down or lay down. I was
Yeah.
like, how can people lay down? Because
Lay
I had
down, right.
such crazy back labor,
Yeah.
and I'm like, I can't like I can take a lot, but I was like, sitting and laying is the last
Thing that
thing
you want to
I
do.
can't. Like it
Right.
was
Right.
excruciating, and so it's just that too,
Yeah.
which historically everyone like moves and is
Right.
moving during
Right.
labor,
Right.
and that made sense to me.
Yeah.
I'm like, I got to move this baby
Yeah.
out. I cannot be laying on my back,
Right.
just going through contractions
It's
for
you
2
can't,
days.
that those
Mm-mm.
contractions are really
It's seismic. It's like an earthquake.
it's like a earth, yeah. And so, I was induced because I was post dates, and so it took a while. I started like on a Friday night, and I just felt the doctor just wanting to section me from the beginning.
Yeah.
So it was like, it was a battle. Every intervention was a battle, until the end. When he came in, I remember it was like Saturday night, like probably around 10 p.m., and he came in and he checked me and he was just like, "Oh, you're fully dilated, let's start pushing." And I was like, "But I don't feel the urge to push. Like, let's just wait. Let's wait until my body tells me, like,
Mm-hmm.
it's time to push." And you're gonna feel it. You're gonna
Yeah.
feel the
Yeah.
head of the baby
Yeah.
in between your legs. You're gonna feel that pressure.
Yeah.
And I'm like, I'm not feeling
You feel
no
poop, so you're
pressure.
gonna
Yeah, you
feel a
feel like you
brain.
have to poop. You're like, I need to poop.
But that's the thing. I'm like, if you can feel the urge to poop, you're actually gonna also feel the urge of a whole
Right.
baby exiting
Right.
your
And so I'm
body.
just like, I'm
Right.
not feeling anything. Like,
Right.
this is
Right.
not what was written in these textbooks. Like, I'm supposed to feel the urge to push, and it's not there. So I'm just kind of like, so I was honestly blessed that all the nurses that took care of me were midwives outside in Africa
Uh,
and the Caribbean. So it was really nice. So when he left, I asked the nurse, I said, "Could you check me?" She's like, "Oh, no, you're not fully dilated." So, but I knew that deep down inside, this man wanted to just section me, and that was his plan. And so I advocated for myself, you know.
Right.
I was like, this is not going to happen. This is what's going to happen. And this is what's going to. And I think you have to listen to the person, you know, feeling and going through all these things.
Yeah.
It's like, I've had women who are fully dilated and they're like, I can't do this. I can't do this. Because what you have to understand too, it's not just giving birth. There's so many emotions
Oh
that come
God,
up
yeah.
during that time, you
Yeah.
know, that we have to kind of respect that to say, is she ready? There's some women that are scared to be moms. Just right at that moment, they're like, oh my gosh, this baby's about to come out. Like, what am I going to do? There's some women that could be releasing things where at that time they could be thinking about the time that they were raped or they were
Right.
touched. Like there's all these
So much.
emotional things that
Yeah.
come out that we have to really respect that the birthing process, it's so powerful.
Yeah.
Um and we we really have to kind of look at it in a different way, not just like, oh, you're gonna have your baby and this is what's gonna
Yeah.
happen and
Like,
da 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 da.
yeah.
We're not thinking about the person and their emotional aspect of it and their emotional well-being of it, you
Mm-hmm.
know. So for me, you know, I then a couple of hours later he came back and he was like, you're still not pushing. I was like, oh, now I feel that urge to push.
Mm-hmm.
Let's push. And you know, and I started pushing really well. And the first thing he wanted to do, he was like, let me use a vacuum. Let me help you. And I think this is where sometimes when we say, you know, doctors, I love doctors and I work with some wonderful doctors. And I think what they do is great. You know, they it's a specialty
When
and they're
necessary.
surgeon when necessary.
Right.
But I also think that there's a lot of them who have never had a vaginal birth or are not comfortable with doing that because
Mm-hmm.
they're a surgeon, and we
Mm-hmm.
understand that. And I think this is where we have to leave it. And I think this is where in Europe they kind of have it down. They were like, midwives will do the births, will do the natural births and all that. And when I say natural, you can still have your epidural, okay?
Right.
We're talking about like vaginal births. And I think in other countries they have that down
Yeah.
where the midwives will do the vaginal birth and the doctors are there when
Well,
necessary
you're
to do
you're
the
you have a more
sections.
full people need to understand a midwife has a more full toolbox to support a vaginal delivery,
Delivery, right?
right? Palpation, all measuring the belly. There and they spend more time
Right.
with that person giving birth, talking. I mean, I would always be like, "Oh, damn, what are we still
Yeah,
talking? How's your eating? How's work?
right.
How's your partnership? What's going on with that?" Because they're trying to
To connect
really
with the person,
understand
understand the whole,
fully.
yeah.
And when you unpack that, then that's when you might say, "Oh yeah, I haven't felt my baby." You know
Right.
what I mean?
Yeah.
But if you have a 15-minute checkup that's like very pathological, like we're gonna
Yeah.
run these tests, and all you're doing is like, oh my God, is anything wrong? You're not actually talking about what
Yeah.
is happening.
Right.
You're then propelled to worry about what possibly could go
Yeah.
wrong. And that's what I love about midwifery is you were very present in the moment with what is happening. Not that you're not giving me that care
Yeah.
and running those tests or whatever, but you're keeping us as mothers present in what is happening to equip us to be present in the moment and feel safe and
Yeah.
empowered during our labor, during our pregnancy, labor, and beyond. And that to me is such a win. But go ahead, finish your birth story because I think it's important for people to hear.
So then I started pushing, and he asked me basically if he could use a vacuum to help. You know,
Right?
for those who don't know what a vacuum is, it's almost like a little suction that you
Yeah.
put on the baby's head, and the doctor will pull to help you. Now, vacuums are wonderful um, um, interventions when actually needed, but they are not for everybody. You know, I think when properly used, they're great. I've called in doctors to be like, she needs a vacuum, and I'm
Mm-hmm.
for that, you know. But I think when a woman is pushing perfectly well, she's feeling it. I think you need to let her do what she needs to do, what her
Right.
body's naturally supposed to do, right? And
Mm-hmm.
just encourage that, right?
Right.
And
Right.
tell her that she is powerful and she can do this,
Yep.
and really kind of support her during that time, right? So I started pushing, and he kept yelling at me. He was like, "Are you declining the management that I'm giving you? Are you declining the management?" And at one point he was just yelling. I was like, "Yes, I am." And I was like, "Let me push." And he was like, fine, push. And he just crossed his hand and just stood there and said, push. And so I pushed, and my baby came out in 20 minutes, you know, perfectly fine and everything. And then so now there is that trust, right, that has broken. Like there's this
Mm-hmm.
relationship now that you just kind of like, I need to put my walls up with
Right.
this person because he's really not being supportive of what just happened right now. And so I started bleeding a lot. My mom was there. My mom was like, "Oh my God, you're bleeding a lot. You're bleeding a lot." And so then he was just like, I was like, "Oh, did I tear? Did I tear?" And he's like, "No, no, no, no. You didn't tear. You didn't tear." He, he is like, "Let me figure it out. Let me figure it out." So he's like, "Okay, the bleeding's good. It stopped." But because there was not that trust that I had with him, I said to the nurse, I said, "I need you to bring me somebody else because I feel that there's something." And so I said, just bring me another doctor, midwife, anybody else. Just bring me somebody else to come check me because I
Right.
do not feel secure with this man telling me that I'm fine because it was a lot of bleeding. And so she brought in another doctor that examined me, and the doctor was like, "Oh, I'm really sorry, but you tore really bad, and we need to take you back in the OR and suture you." And so this is why I say, you really need that relationship with that provider and making really have understanding where your patient comes from and just supporting it, right? So here are two individuals. I'm trying to have this vaginal birth, a doctor who does not believe in it and wants to section me. It's really just we're bumping heads
A
at this
power
point.
struggle. Right.
Yeah. And so I'm really thankful that, I knew I am in the medical field and I knew what I was talking about and what he was saying and I understood and I could actually like, fight for it and
Right.
fight for what I want. But there are many women that do not,
But then he hands
and
off you, for lack of a better
yeah,
term, and you tore, and there was no
yeah.
need for
And
that.
there was no need for that. So, yeah. So, but, told my OB, I was like, never again with this one. So he was
Yeah.
not present at any of my other births. And I had beautiful births.
Yeah.
The other two with attendings, with doctors, that were very supportive. So I think it's really um just understanding that this is a human on this
Yeah.
bed, that has emotion, that has feelings, but also being like, listen to that woman's intuition,
Yeah.
right? Listen to her intuition to say, I can do this, or this doesn't feel right, or let me try this, or let me try that.
Yeah.
I've had patients who are just very anti-epidural. They're like, I don't want an epidural, I don't want an epidural. But when I'm seeing the labor and how it's going, and she's so intense and she can't relax and she can't do this, I have a conversation with my patient. I'm
Mm-hmm.
like, listen, I know you're anti, but I really think
Yeah.
you would benefit from that.
No,
It
that
would,
happened in mine.
right, it would
Lindsay said it turned
relax.
to
Yeah.
suffering.
Yeah,
She said,
because
"You're
it was just,
strong, but you're
you're
suffering,
suffering
and
and
you
it's
we're
not
only
right.
at 4 centimeters, like 2 days
Correct.
in, like,
Correct. And it's not helping because you have to be able to relax your pelvis for that baby to come down, right?
and to
So,
push."
and to push. Right.
And I had to push Samuel for 3 hours. So had
Yeah.
I not had that like little bit of respite,
Right.
and I think other people should know too, like you can turn it off. So I turned my epidural
Of
off,
course.
and then I felt my pushing, which
Yeah.
then I was like, can we?
Yeah.
That was in the ring of fire moment where I was
Yeah.
like, can y'all put some water on it? And they were putting it in my mouth. I'm like, no, can you pour it down there? Because it is hot. I learned what ring of fire
Ring of
was.
fire was.
I was like, it doesn't matter that I had that damn epidural because I felt every ounce of
Yeah.
stretching.
Right. And
Whew.
if we turn it off, and there's some women where I do turn it off because I'm just like, I need you to feel that to be able to know where to push.
Right, exactly. Which
Yeah.
is why
So
I'm
you
like
could,
so
yeah.
passionate about teaching women how to push, which is kind
Right.
of crazy. We don't do that
Yeah.
more. Okay. So, I feel like we had our like fun, fun session before we started about all the things that people really want to hear about. So I'm going to start Moms After Dark. So
Okay.
will you participate? I think I know the
Sure.
answer. Yeah. Okay. So we're going to like start a whole like Patreon subscription situation. And it's like so exciting. We all had like the fun, juicy Mom After Dark conversation before. We probably like always have some
Yeah.
version of a Mom After Dark
Yeah.
with wine. She's yelling at me. She's like, why didn't you just tell me to bring wine? I'm like, I'm new at this. It's going to become very boozy and maybe juice and kombucha thrown in there sometimes. Wine and cheese. I feel like we're going to have a charcuterie pretty soon. She'll be back. And then for just like like, now or post-show question, just, I feel, I laugh as I say this, like, if you knew one thing, what would you share? But I think just in general, like pregnancy, birth, motherhood, like what would you give as a gift um, to mothers, that you really feel is like a helpful thing to know?
Oh, wow. Okay.
I know it's a lot. Okay, okay. Well,
So
actually, we have two. Let's you can marinate that one.
okay.
You almost got out of this. You were probably like, I'm not going to remind her. What are you giving birth to next? And then we'll go back to the other question.
Um, as far as what, like in my life?
Yeah.
Okay, so, um, what do you, what should I do? Like,
I know. I think this is what we worked on with our vision boarding.
yeah. So I think, so I actually started a jewelry company
Yeah.
a couple years ago after I gave birth to my third child. I've always loved jewelry. I think that, it's just it's a great way to like kind of express yourself and just feel. I think that a lot of women after we give birth, right, we're so wrapped up in being mommy, right? And so we kind of forget ourselves and we put ourselves like in the back burner. And I think that years later you kind of be like, well, who am I again? Like I want
Mm-hmm.
to feel me and who I
Right.
was. And I've always been the type of woman that like dress up and high heels and all that. And then you have kids and you're like, I can't wear those high heels anymore. It hurts and blah, blah.
And we're boy
So
moms. So
yeah,
there's that. Yeah.
we're the boy moms where it's like you can't run after your kids in high heels, right? So you're always in flats or barefoot and all of that. And you just want to wear like practical things that are great because, you're going to have throw up. You're going to have all these
All
things,
the
pee,
things.
poop. I mean, especially boys, you open that diaper and it's just like, shh.
Yeah.
So, so I started this company because I did want to just empower women to just find themselves again and
Yeah.
just feel loved and special and feel like, okay, I'm finding myself. I can dress up and just pieces that you could wear and invest that has to do with your children, that has to like, it could be your children's initial, the birthstones, that still brings in that mom aspect but still dressy enough for you to feel like I can go out and feel like I'm dressy, right? And I
Yeah.
think that jewelry is like it's like the last touch to everything, right? You always wear your outfit and you're just like, okay, now I'm gonna like accessorize it, right?
Mm-hmm.
And what am I gonna wear? And you put all these jewelry and it brings the whole kind of you together.
Right. But you could have like
And
a white tee and jeans on and then you pop
exactly,
some
and
jewelry on
still
it.
pops
Yeah.
jewelry. I will be that mom who's like at pickup full of like diamonds all over, and
Yeah.
that's just me. And I think I encourage women to do that.
It's
To not.
important.
It's important to feel sexy again, to be like like you. And I think that's something that even my mom said to me.
Yeah.
You know, um, don't lose Weha. Don't lose the person
Yeah.
that you with because that's who your husband or your partner fell in love with, right?
Right.
So don't forget her. And I think that we need to take care of us first
Yep.
so we can take care of others. And I think that's really, really important as a
Yeah.
mom.
Yeah.
And that would probably
Like
be like
what you would give to women.
what I would
Yeah.
give to
Yeah.
women. It's like, don't lose yourself. Like you really need to put yourself first.
And it's not being selfish, right? To
Right.
like spend money on yourself,
Yeah.
or time for yourself.
Right.
And the other thing is, we have boys, but it teaches them how to care for a woman.
Yeah.
When we take time for ourselves to work out or go out with friends,
Right.
or it doesn't even have to be like a massage or whatever. But it's also like Samuel, when I get dressed and I'm like, oh, I'll throw the joggers on that day, he was like, don't you have pants that fit your body? And I was like, okay, boo. But he enjoys, he's like, are you putting makeup on, mommy? Are you
course.
putting lipstick? Because he sees when I do my auditions or whatever, when I do that.
Right.
But it's an adornment, and
Yeah.
he appreciates it. And I think all of us appreciate a pretty thing, or
Right.
whether that's lipstick or getting your nails done or, jewelry. And we're teaching them that that's an important part of life. So hopefully with their friends or future partners,
Right.
they enjoy that as well. And I
course.
appreciate that about you, because it's just like, you're a walking reminder of treating yourself as a queen, because we really are, as mothers. What we do, like when I say queen, it's not just the pretty image of a woman on a throne,
Right.
but the fact that she runs an empire.
Yeah.
And as mothers, we are running empires.
Yeah.
The amount of logistics that go into any given hour
Yeah.
like, is
a lot.
like, we're the shit,
Yeah, yeah.
you know? And so we should look like the shit and
Yeah.
feel like the shit because we do a lot of shit. That's kind of
That
how
is
like I
true.
feel like. So wait, I do all of this and I'm supposed to look
Right.
like crap and feel like crap?
Yes.
No.
Yes.
Like I'm done with that. And I think that's why we got along is because it was another person who spoke my language.
Yeah.
Because I'm like, I'm me first. And
Yeah.
everybody's better if Rachel is a whole person.
Right.
And then Rachel Dawn's mom has
Yeah.
hat, friend hat, daughter hat, worker hat, visionary hat, nonprofit hat. But I have to be me first.
Right.
And I just want to give grace to you. And I want you to go ahead, tell us how we follow your jewelry company.
So it's called Nogama. It's after my children's name. So my first child is Noah. So I took the first initial of
I
every
never knew that.
children's
Okay,
name.
go ahead.
So the first one is Noah, Gabriel, and Malachi. And so that's how I came to be called Nogama. So it's the first
And
two
like
letters.
mama. Is that part the
No, Nogama, Malachi.
Oh,
M-A.
Malachi.
Yeah.
But it's kind of like mom
Yeah.
in there too.
Yeah.
I love that. That's
So
like
that's
my
how-
Oakland coming out. I'm like, no got mama. No got my mama.
So it's Nogama, Nogama, after my kids.
I love that.
Yeah.
It's amazing. So follow and support. This was good. You know, I'm gonna have you back for more, but I appreciate you being so
Thank you.
supportive.
Oh, you're so welcome.
And, you know, I just was so excited. I knew there was something, there was a reason why we met. I think personally there's a lot of reasons, but professionally to have met you, I really want people to like watch this video so you can like, I want you to listen to everything that Weha shares, but really all that she brings to her profession, to motherhood, to femininity. Y'all, she can host a meme party and gala and all the things. She has a whole lot of talents. But we need you in this space. And so I see you. I appreciate you. I thank you. And anybody thinking about becoming a midwife, do it.
Yes.
Talk to Weha. She'll support you through this.
It is a beautiful, beautiful profession.
Yeah.
It's really beautiful to be that first person, to catch that baby.
It's such
it's
a
really
gift.
Beautiful.
Yeah.
Also, midwife, we say catch it. We don't deliver. We catch.
Yeah,
them.
we catch. They're
because the woman
baby
delivers.
catchers.
Yes, we just catch them.
Yeah. And I'm like, push, use your transverse abdominals, relax your pelvic floor.
We are just there to catch it in our hands, but the woman's really doing the work. So
absolutely. Yeah. Well, thank you. Yay.
Thank you.